Hey everybody, welcome to Healthline. I am Gregory Zarian, and the conversation today is all about diabetes. Did you know that there's two types? Did you know that close to 26 million people suffer from diabetes, adults and children? So I decided to bring you the best of the best from Glendale Adventist Medical Center. I'm going to call them my Diabetes Dream Team and share with you all you need to know about diabetes, where it hits you, where it affects you, and what to do to push diabetes away. Starting with cardiologist Dr. Harry Balliet. Then we have podiatrist, Dr. Hermos Avazian. Then we have Dr. Marjorie Cassens, ophthalmologist, in vitro retinal surgeon. Then we have Dr. Emil Avanes, Doctor of Internal Medicine, and Dr. Zarmine Nakashian, certified diabetic educator and professor. Welcome back to Healthline. I am Gregory Zarian. So the conversation today is all about diabetes. Do you know what it is? Do you know how many types are there? I figured I'd start off with one of our Healthline favorites, Dr. Zarmine Nakashian. She is the diabetic educator here at Glendale Adventist Medical Center, and she's also a professor. How are you, one of my favorites?
Thank you, I'm fine. Thank you for the invitation.
Nice to see you. So bottom line, doctor, what is diabetes?
Well, diabetes, when the blood sugars are not metabolized correctly, adequately, then the person presents with high blood sugars, and then that is called diabetes.
But I mean, sometimes, depending on what we eat and what we don't eat, our blood sugar does spike.
Right. But the body, well, we have an organ which is called pancreas. The pancreas releases insulin, and then with the assistance of insulin, the sugar that got produced from the food get metabolized.
Okay, so it finds a balance.
Right. So that is called euglycemia, meaning that the blood sugar is brought back into normal levels in the blood. So that's normal.
Okay.
So, but if there is a problem with insulin release, or if the cells are not utilizing the sugar adequately, so then the blood sugar will be high in the blood, and then so the blood sugar will rise.
And that's when it stays higher.
Higher.
And that's diabetes.
That's diabetes.
And there's two types of diabetes, right, doctor?
Right. There is type 1, and there is type 2. With type 1, the organ, the pancreas is there, but the beta cells are not releasing insulin.
Okay.
So there is insulin deficiency. There is no insulin, zero insulin. So the person who's diagnosed with type 1 diabetes, they have to inject insulin in order to metabolize the sugar that is produced from the food that they're eating.
Okay.
But mainly, the prevalence of type 2 diabetes is rising. That's the issue.
But type 2 is, if you had to get one, you would want to get type 2 because that can be treated with food and lifestyle choices, true?
The type 2 is like obesity and then weight gain, like on the stomach.
Which is not good.
Right, so, and then lack of exercise. Obviously genetic factors, so like it will predispose the person to develop type 2 diabetes.
Got it.
So now, obviously, there is less exercise in the community. So the population are more in tune eating big portions of meals and non-balanced meals. So for that reason, there is a lot of fat on their abdomen. That is called central obesity, which is making them to be insulin resistant, which is making them to develop diabetes.
Why do you feel there's so little activity now across the country?
Well, obviously people are working long hours, they're commuting, and then so there is less time for exercise. However, with diabetes prevention program, that research that they did, it showed that 150 minutes a week of moderate exercise, which anybody can do it. Walking, vacuuming, climbing the stairs, swimming, anything that you like, it will defer the inception of diabetes for many years. So it is very much advisable that people find that 30 minutes every day to walk, to swim, to dance, just like to defer the inception of diabetes if they're predisposed of having the disease.
You know, doctor, let me back up real quick. You also said that people become more diabetic, longer work hours. Also, don't you agree that more people spend time in front of the computer, in front of the TV, on their iPhone, their Game Boy? More stuff is spent watching things like that instead of actually going out, spending time with the family. exercising as a family and your friends and hiking and running. What do you say to families that spend more time in front of the TV and not outside with the family? How do you invite them to do more?
Well, there has to be like a family affair. The exercise has to be family affair. So if a family likes the outdoors, let them hike together. And if the family, they're more artistic, they want to dance, let them dance together. So like there is an activity that fits everybody's style. But the key is the consistency. They have to plan and then be consistent.
I love that. And one thing that you said is 150 minutes a week to get your health on and your lifestyle on. And also, it's about healthy choices. You know, speaking of dancing, I'm just going to be a little carefree and bring Dr. Nakashian with me before we go out. And here's the thing. Everything we do is a choice. And if you can keep diabetes away, why not dance? More when we come back. Ready? Yeah. Welcome back, everybody. So our conversation today is all about diabetes. And when you think of diabetes, when do you think about the feet? Joining me now is Dr. Hermos Avazian, and he is a podiatrist here at Glendale Adventist Medical Center. How are you, doctor?
Very good. Thanks for the invitation. And I got to tell you about diabetes. Most people who have diabetes, actually, they have a lot of foot problems.
No, how is that, though? Because when you think, as I just said, when you think about diabetes, you never think about the feet. Why is that?
I think because you always think in general term, because most people with diabetes have a lot of heart disease,
sure.
And you think more in terms of vascular, but when you think of in terms of vascular, they have a lot of feet problem too. That's where the problem starts, because when they have poor circulation, that's when they run into trouble. And that's why it's very important to control their diabetes, because when they start having problems with the sensation, problems with the circulation, that's when they start having ulcerations, they have other problems. Most people come in because they have issues with the nails, issues with the calluses, they start using medications that they shouldn't be, then they start developing ulcerations. That's when they have a lot of problems. And most of our admissions in the hospital are actually because of diabetes, because they have a lot of diabetic foot ulcers or other issues, infections, things like that, even simple ingrown toenail that they go to a pedicure and they start developing an ingrown toenail and they get infection from that. Sometimes if they have poor circulation, they start having developing gangrene, and that's when the problems start. And sometimes even because of foot problems, sometimes we can diagnose them with diabetes. So.
Well, that's okay. That's fantastic. But here's a question. Let me back up a little bit, doctor. When you say sensations,
yes.
What are some diabetic sensations in the feet?
Well, there's, in general, sometimes when diabetic have issues with burning sensation,
okay.
They have issues with numbness.
Would the burning be on the toes? Would it be underfoot? Would it be in the heel?
It could be usually starts at the toes, at the tip of the toes. Sometimes it just moves up to the ankle.
Okay.
But we call it foot and ankle or the sock distribution, basically, because they have all the way to the ankle. They start having numbness, tingling, and it usually starts from tip of the toe, moves up. Because a lot of times what gets confusing is obviously most of these people have back issues too, and we have to separate, is it the back problem or is it the diabetes that's causing the what we call neuropathy, which is the numbness in the toes, or sometimes it could be painful. It could be burning to the point that they can't sleep at nights. It could be a sharp pain that they're experiencing and they cannot sleep. And it all could be because of neuropathy, and it could be because of diabetes.
Now, what about, you were saying something about the nails. What are some of the signs and symptoms of toenails?
It could be because of poor circulation. Sometimes the nails get very thick. They start looking like a mycotic nails, what we call it, because they're very thick. They break. They're discolored, like yellow, black, and a lot of times they start developing infections underneath the nails. They get some discharge, and sometimes they get ingrown toenail problems, and that's when we need to address that issue.
Doctor, thank you so much for your time. I appreciate it. So you heard it from Dr. Avazian. If you have any burning sensation in your feet, if your toenails look a different color, there's pain, it goes up to your ankle, it's not associated all the time to your back. It could be diabetic-related circumstances. More when we come back. Don't go away. Welcome back, everybody. Did you know that some of the signs and symptoms of diabetes are thirsty, fatigue, and blurry vision? We've already talked about feet, signs and symptoms. Joining me now is Doctor of Ophthalmology, Dr. Marta Rekassens. She's I'm going to say this right. Okay, ready? Vitreoretinal surgeon. How is that?
Very good. Thank you, Greg.
Yay! Okay.
Thank you.
Doctor, when we think of diabetes, again, as I was saying earlier about podiatry, we don't think of blurry vision in the eyes. What is the connection to diabetes in the eyes?
Well, that's the most common symptom. That's usually the primary onset of diabetes. You usually have elevated blood sugars. And when your blood sugars are over 200, it blurs your vision. It actually causes swelling at all levels of the eye. And by swelling of the lens, you become more nearsighted, your vision becomes blurred. And a lot of times people don't even know they have diabetes, but they have the new onset of blurred vision. They come to the office, the rest of the eye looks fine, or they can even have retinopathy already. And then we send them back to their primary doctor to check their blood sugars, and they have elevated blood sugars.
Because most time people go to the eye doctor or the ophthalmologist and their vision is off or blurry or can't see far or close. They think it's something with the eyes. Not many people think of it being connected to diabetes. So what is the connection of blood sugar and the eye?
Well, the blood sugar, by being elevated, causes an osmotic effect, and it helps cause a shift of the fluids into the eyes. So the lens swells, the cornea swells, and even the macula can swell, causing blurred vision. Usually, patients with diabetes type 2 will have the onset of diabetic retinopathy after 10 years of having diabetes. But if they're poorly controlled and their blood sugars are really high, they're not taking care of themselves, they're not taking their medications, then they can have the onset of diabetic retinopathy much sooner than the expected 10-year onset for 50% of the diabetics. If you're type 1 diabetic, you really need to use insulin from the on-go, and then you usually don't have as many symptoms as a type 2 diabetic who's adult onset and may have elevated blood sugars and not know that they have diabetes.
Is this symptom common with men and women, or specifically more toward men or more toward women?
No, it's not. It doesn't discriminate against men or women. It could be, either one. We were saying about small vessel disease, the small vessels are affected when the sugars are elevated, and they become porous and they leak fluid from the blood vessels, and that's when you develop abnormal swelling in the macula and blurred vision. There are two types of diabetic retinopathy. Type 1 is the background or non-proliferative diabetic retinopathy. That's the earlier stage when you don't have abnormal blood vessels.
Okay.
And type 2 is the type when you have the abnormal blood vessels and you have the possibility of bleeding and having a retinal detachment. The best advice I can give diabetics is to control their blood sugars as soon as they find out that they have diabetes. Follow your doctor's advice and have a regular exam with your doctor as scheduled, as he schedules them, and then make sure that you see an ophthalmologist or preferably a retina specialist that can make sure that you don't have any diabetic retinopathy.
So, doctor, in regards to everything that you're talking about, the signs and the symptoms and the blurry vision and what have not, just say somebody does not know they're diabetic, and just say the blurry vision occurs once, twice, 3 times. How many times do you feel that could happen? And then the patient must come to the doctors and find out what's going on. Because sometimes I'll wake up in the morning and my vision will be blurry. Obviously I wear glasses. I know I'm not diabetic. How long is that occurrence to continue for someone to then think, oh, you know what, this may be diabetes related?
Well, there are other causes of blurry vision. You can have dry eyes, and just the mere fact of blinking after you wake up, it could clear up your vision, or using some artificial tears will help clear up your vision. But when you're diabetic and your blood sugar goes over 200, your blurred vision will last at least 6 weeks after you control your blood sugars. So if your blood sugars remain over 200, your blurry vision will remain so until you get it under control. And another thing is, if your vision's blurry because of elevated blood sugars, it's not a good idea to have a prescription for glasses, because as soon as you get your sugars controlled, then those glasses won't be helpful to you.
So bottom line is, pay attention. If your vision has continued to be blurry, then see a doctor and say, hey, maybe this could be diabetic related.
Yeah, and also upon diagnosis, when you get the diagnosis that you're diabetic, you really need to see an ophthalmologist or preferably a retina specialist.
Doctor, it was an absolute pleasure. Thank you so much.
Thank you.
So the eyes have it. If your vision remains to be blurry consistently, just call your doctor, make an appointment. More when we come back. Hey everybody, welcome back to Healthline. I'm Gregory Zarian, and our conversation is diabetes. Did you know that 79 million people are undiagnosed diabetic? So what does that mean? Does it mean that we're eating poorly, not getting enough exercise? Here's another question. Can obesity cause diabetes? Joining me now is Dr. Emil Avanes. He is the internal medicine doctor. How are you, doctor?
Very good, thank you. Thanks for having us.
Thank you for being here. Out of the gate, can obesity cause diabetes?
Yeah, you've opened up a can of worms for us today because you've touched on so many different things that we can actually talk about. I'll try to keep it brief because I'm very passionate about this stuff. So obesity is one of the leading causes of diabetes. And one of the things that I would like to talk to our viewers about is the fact that there's two ways that diabetes gets diagnosed in our office. When patients come to our office, it could be that they haven't seen their doctor for several years, and they come in, we do some tests, and they show really uncontrolled diabetes. That's one way. The other way is if they get their yearly checkups, and we slowly start seeing signs of diabetes, and we're able to control it. Now, that aside, we know for a fact that obesity is directly correlated with diabetes.
Well, I want to say one thing about this country. We are the most obese country in the world. Over 70% of this country is obese. So it's tragic.
So if you go into the CDC data and you look at 1985, less than 10% of California has obesity. As you go on to the next 10-year mark, 1985 to 1995, that number goes up to 10 to 14%. 2010s was 20 to 24%. So this is, we live in a society that I like to call obesogenic. And
which is pretty much a quick fix society.
Well, there's just so many assaults on our health from what we eat to our lifestyle that we really need to think about these things when patients come to see us in the clinic as a first step. So we like to focus on that, and I think it's very important for our patients to know that diabetes, well, I'll just give an example of a population in. So a bariatric population that they did a study on in Cleveland Clinic, they did surgeries to improve their weight because they really needed it. These are people who are like 300-400 pounds.
Sure.
So they were able to get rid of diabetes 80% of the time when they got to a goal BMI and not even take medication.
And what is a BMI, doctor?
Their body mass index, which kind of correlates their height and their weight.
If you had to say to anyone how to keep diabetes away, even if it's not in your family or hereditary, and it's about living a healthier lifestyle, not doing so much fast food and quick fix, what is your doctor recommended solution?
It's very, very important to focus on our choices, and the resources are many. Glendale Adventist has a community care center that can provide all the education in the world. There are support groups that are available. There are physicians who are willing to discuss these matters. But it's all about the choices. And one of the most important things for every individual to realize is how their choices could support their health, and they could create health in their lives for many years to come. These numbers are not a joke. They're real. The fact that our obesity rate has tripled in 30 years is due to the unhealthy choices that we're being offered and we're taking. We really look down upon, smoking and drug abuse, these things that are addictive habits. However, a lot of the food that we eat is just as addictive as some of these quote-unquote drugs. So I would say, Gregory, the most important thing is that people start to really assess their choices.
Thank you, doctor. So you heard it from the doctor. Everything we do is a choice. So what kind of healthy choices are you making right here, right now? And if they're not all healthy, you can change that right now. More when we come back. Welcome back to Healthline. So the conversation is all about diabetes. We've talked about the feet. We've talked about the eyes. We've also talked about internal medicine. But we haven't talked about the heart. So I thought I'd go to one of our favorites, Dr. Harry Ballion, cardiologist here at Glendale Adventist, and talk about the connection between the heart and diabetes. How are you, sir?
I'm doing great, thank you. Thank you for having me.
Always great to have you.
Thank you. So the heart and diabetes, there's a great connection. It's basically, diabetes is like having termites in your walls.
Oh.
And the walls of your house and the same connection as the walls of the arteries of your heart. When you have diabetes, you basically have the same risk factors as somebody who's already had a heart attack. And we see time and time again that people with diabetes, they have higher incidence of unstable plaques in their arteries of the heart. Even a plaque that is 20 or 30% in diameter is, in diabetics, it's unstable. It basically is ready to rupture. And when a plaque ruptures, that's when we have a thrombus or clot buildup within the artery, and that's how people have heart attacks. So in patients who are diabetic, our thresholds for working them up for coronary disease is much, much lower. And we see time and time again that diabetics are the ones that have inherently repeat visits to the hospital, and then they have premature onset of heart attacks, strokes, kidney disease, and peripheral vascular disease.
Are there any signs and symptoms, because we've talked about the feet, we've talked about the eyes. Are there any specific signs and symptoms in regards to the heart and diabetes that people should be looking out for?
Absolutely. With diabetes, essentially all bets are off. The classic chest pain, angina, and that people have with the nerve endings that become damaged with diabetes. Just as we get numbness in the toes when we're diabetic, or we don't feel our toes, we may not necessarily feel chest pain. So somebody who has simple indigestion or shortness of breath, their exercise tolerance is less than their usual, that could be a sign of blockages in their arteries. So when somebody's diabetic, we don't necessarily focus on, do you have classical chest pain radiating to your jaw? We may ask them, are you more tired than usual? Do you feel like you're more winded than you're normal? And that in itself can be enough to say they may have a new plaque rupture, they may have new narrowings in their arteries, so that should warrant us to search further. That should be a red flag for us to say we should do a stress test, even jump for a cardiac catheterization.
So doctor, talk to us about cholesterol and diabetes.
It is imperative that people who are diabetic are very strict with their diets.
Okay.
And when we say diet, we want to make sure we focus on the numbers. Total cholesterol, LDL, HDL, triglycerides. If somebody's diabetic, we want to focus on LDL less than 100 and preferably less than 70. Okay. We want to treat these patients as if they've already had a heart attack or they have advanced vascular disease. So lowering the cholesterol, especially in the setting of diabetes, is going to more or less prevent those unstable plaques from rupturing. Okay. So it's like an inflammatory process that we want to calm down. We want to more or less take away from our arteries. So an LDL target of less than 70 in a diabetic patient is ideal. And essentially, this is kind of a three-headed monster. High blood pressure, diabetes, and cholesterol go hand in hand. When you lower one, you actually help control the other of the three arms. So patients that have poorly controlled hypertension, they also have hard to control diabetes, and then their cholesterol a lot of times is completely out of range. So healthy diets, we talked about, we want to basically lower their intake of dairy products, saturated fats. We want to probably focus more on monounsaturated fats such as almonds, walnuts, and stay away from the polyunsaturated fats. Fried foods, the red meats, all of those should be taken away from the diet.
And lots of green vegetables and fruits.
Absolutely. And so exercise at least 3 times a week, if not more, and 20 to 30 minutes a day of aggressive exercise, not just passive walking. You want to raise your heart rate to at least 130s, 140s, and especially more if you're younger. And that essentially is going to keep your metabolic rate high, and you'll be able to burn off the calories faster.
And doctor, last question. In regards to heart surgery, is it the same for somebody that has diabetes and not?
If somebody's diabetic, our threshold for sending them to, and they have blockages, our threshold for sending them to surgery, like open heart surgery, would be much lower. Somebody who has 3-vessel disease, as we call it, that means they have blockages in 3 arteries of their heart, they would probably do better with open heart surgery than having multiple stents in their heart.
Got it.
As a diabetic, you're more likely to develop more scar tissue within your stents, and you're more likely to have repeat visits to the cath lab. So the guidelines suggest 3-vessel disease in somebody who's diabetic, they would probably do better with open heart surgery than having multiple stents in their artery.
Doctor, thank you so much. And here's a takeaway. if you're working out and your breathing is a little bit different, all you got to do is call your doctor. Could be nothing, could also be diabetes. You are in charge of your health. Everything you do is a choice. So why not make them healthy choices? For more information on all of these doctors, please follow us on our Facebook page. Stay to the end of this program and other doctors will be listed. I am Gregory Zarin. It's a pleasure. And remember, the most important conversation you're going to have, it's about your health. So why not have one right now? We'll see you next time. Take care.